Hi everybody, I'm Dr. Wanjiru and you're watching Footsteps to Fertility. So today we are going to be discussing the steps of IVF because a lot of people are asking or have asked, what does it entail? What does it do to my body? How much time do I need? And what really happens when I'm doing an IVF cycle. So keep watching. So I have this discussion nearly every day with patients who come in and they want to know exactly what does IVF entail, what are the steps, what do I need to be aware of. So step number one is usually that you would come into the clinic on the first or the second day of your menses. And what we'd really be trying to discover on these 2 days is, are we ready for the IVF cycle on this month? Is it your best month for an IVF cycle? And what this would entail is having some blood tests, having a vaginal scan, and basically just talking about the process and making sure that you're emotionally at the state where you would be able to go through this. And once we decipher that, usually you'll be back on the second day or the third day, depending on when we're starting. Now, so the second step would be starting the injections. And I know a lot of people are afraid, and this is the scariest part, these injections every single day for 10 to 12 days. It's not that bad for most of my clients, that's what they have said. So we usually do injections for 10 to 12 days, and you could decide to self-administer the injections at home or come into the clinic and get your injections every single day, depending on what works for you. So this is step number 2, the daily injections. Now, step number 3 would really be now our monitoring. So at the first scan, we're able to see what we need to see about the eggs. And during the 12 to 10 days, we do scans. So scans are done on alternate days, probably starting from day 7 or 6. But it's just a process where we see, are the eggs growing, and what do we need to do? Do we need to adjust the dosage? Do we need to add another drug depending on what regimen you're taking? So it's really important to come in for the scan so we'll be able to determine how the eggs are growing and eventually be able to decide when we need to trigger. So the first step is really trigger. So what trigger means is that once we are happy and satisfied with the growth of the eggs, when they've grown enough, then we will do an injection. That is our last injection usually, and most of the patients are very happy it's the last injection. And what this last injection does, it matures the eggs so that when we remove them, 36 hours later, we get as many mature eggs as possible, because we don't want to get immature eggs, because then they will not fertilize. So that's the fourth. So the fifth step is the oocyte retrieval stage. And what oocyte retrieval, it is really D-Day for a lot of patients, because that's when we are able to extract the eggs. So this is a surgical procedure where we lightly sedate you for probably 10 to 20 minutes, depending on how many eggs we're going to retrieve. And we're able at that point to enter the birth canal. So there are no scars, nothing that we do. We enter the birth canal, and we're actually able to suck out the oocytes or the eggs and keep them in a test tube in a warm environment, transfer them to the lab, and at the lab, that's where now everything happens. So that stage is usually day probably 12 or 14 or 15, depending on the different people. And it's a procedure where you have to starve before, because you are in theater and you do undergo anesthesia. A lot of people have anxieties and fears, but to be honest, it's not that bad. So step 6 involves the man. So this is where the man is involved. Imagine the whole process. Okay, you are involved, but this is the main step where you have to give us a sample, and your sample is washed and treated, and then at that point is where we either do the IVF or we directly inject the sperm into the egg, which is called ICSI, in the lab, and allow fertilization to occur. So step 7 is where most of the lab work goes on. So for the couples, they are at home resting, while in the lab we're ensuring that fertilization has occurred and that the embryos that have been formed are growing to the right stage. Step 8 is usually when you come back into the fertility clinic, And at this stage, we are going to do an embryo transfer. So it could be on day 3 or day 5, depending on what is decided, and this is a discussion we have with you. And on this day, you, as the woman, you come in with a full bladder, and we're able to just insert your embryos into your uterine cavity. It's a small procedure that takes about 10 to 15 minutes. It's not painful, quite a bit, maybe uncomfortable because you have a full bladder, but it's a very important process, and we really like that you are at peace and restful on this day. Step 9 is the 2-week wait. And I know for a lot of women that this is one of the worst stages of the whole IVF process, because this is where you just have to wait, sit back and do nothing and hope and pray that implantation has occurred. It's very stressful, but we do advise that you rest, especially on the first 3 days after the embryo transfer. After that, you can go about your daily duties, but also in a bit of a restful way. It's tough on all of us as we wait for the 2 weeks to elapse and we do a pregnancy test. So during these 2 weeks, we're also supposed to be getting our progesterone supplementation and some other supplements depending on which protocol you are. So please don't forget that. Step 10 is the day of reckoning. It's the last step, but sometimes the hardest step for everybody. It's the day when you come back into the clinic and we do the pregnancy test to see whether we are pregnant or not. We do usually do a blood test, which determines better than a urine test whether we are pregnant and whether implantation is strong, or do we have to supplement with more progesterone, maybe injections, to try and keep the pregnancy. These are the 10 steps of IVF. I hope you've learned something. If you have any questions or queries, feel free to contact or email us, and we will try as best as we can to answer them. If you like the video, please subscribe to our YouTube channel, share the post with other people who may be struggling and need this information. This is Dr. Wanjiru, and you're watching Footsteps to Fertility.